Hello, my name is Hyundong Cho. I'm a Master's of Public Health student at Liberty University. This presentation will provide you an overview of my practicum experience with information on some projects I've worked on and some insights I've had after the experience. For this practicum, I interned at an accountable care organization called Netrin Health. They are a physician-led network of primary care providers in Maryland that help improve practice performance and outcomes by providing analytics, telemedicine, remote patient monitoring, and care management. The goal is to improve practice performance and improve patient outcomes to generate savings for Medicare. The savings that are generated are given back to the ACO to be distributed by network providers. This financial incentive motivates providers to provide high quality coordinated care. The projects I completed during the internship directly supported the care management program for Netrin Health. One of the first projects I worked on was creating the Patient Education and Community Resources database. A database already existed, but it was very disorganized and outdated. I was tasked with taking the existing database and reorganizing them by deleting outdated and redundant files. A new database was to be created on a separate file sharing system called Basecamp, where the care managers would be able to access the files much more easily. The goal was to have an easily accessible database of patient education handouts and resources that care managers could give to patients in the care management program. By increasing patient knowledge about their health conditions, we can try to improve health outcomes by educating patients about their current health on how to take medications properly or what to make appointments to see the provider. Community resources database included information by counties in Maryland so that care managers can provide patients with resources they might need that is not necessarily medical related, but necessary to improve their health, such as paying for utilities or paying for medications. The next project I worked on was evaluating Netrin's care management program based on the National Committee and Quality Assurances Standards for Case Management Accreditation. An organization that is accredited shows that they are a health plan that is truly committed to meeting quality evidence-based standards. This was done along with the Director of Care Management. She knew that the Netrin would not meet standards, but the goal of this project was to do a mock evaluation to see where Netrin can improve the care management program for future accreditation. My role was to create a spreadsheet with all the elements and standards so that myself and the director could check element by element whether Netrin met standards. The scoring was done after each section, and at the end of the project, we did see that Netrin did not meet standards, but that was okay. An action plan was created to improve other areas of care management program. The final project that I worked on was identifying the top 100 high-cost patients for Netrin. This project was one that I brought to the attention of the care management director. The goal was to identify the top high-cost patients by analyzing Netrin's internal patient database and Medicare claims data. Medicare claims data showed the top high-cost patients for the past 12 months, and these patients were cross-analyzed with patients that were not in the care management program, and those patients that were not currently enrolled were to be outreached to be enrolled. Those patients that were already in the care management program would be outreached to be enrolled in the intensive care management program. The intensive care management program the goal is to provide extra attention to the patients for however long they needed to reduce overall Medicare costs. This was done by making sure their social determinants of health are met, and make sure some of their medical needs or any gaps in care are met by with the help of the care managers. This practicum was a valuable learning experience for me, especially since I was able to apply population health strategies in a real-world setting. Before the internship, I did not know what an accountable care organization was or what they did. My eyes were open to a whole new world in healthcare called value-based care. It's a promising holistic approach to healthcare that promotes providing quality care to prevent unnecessary medical spending. I also got my experience using real health data and applying them towards a health program, and I have a better understanding of how health information exchange works between entities. Some challenges I faced during the practicum were that picking the right handout was difficult. There were also many patient health education material out there that it was hard to find just the right one. There were also some handouts that only one language version was available, and this made it also challenging. Another challenge was that Maryland is a very large state with 23 counties. Finding resources for every single county was very difficult, with 13 categories and multiple subcategories within each resource. Um, this was very time consuming. As the organization grows, however, it could be beneficial for them to use a third-party service for education materials such as CRAMES, where they use evidence-based videos and education handouts that can be emailed or downloaded for care managers to be able to distribute to the patients. Another service is called Aunt Bertha, which is a online community resource database that is free, and also there's a paid service where patients and providers can search for community resources and by zip code, such as transportation, food, utilities. Using services like that could be easier since they update and make it easier for people to search the information they need. A challenge for the high cost project was my limited Excel and data analytics skills. Cross-referencing multiple patient charts was very time consuming. Being able to identify patient lists that were on one Excel sheet and cross-referencing them from another sheet was very difficult because I did not know how to do that. In the future, learning the skill could be very beneficial. In conclusion, even though Netrin's care management program is not accredited, it's still an effective program in helping patients get care in between the times they see the provider. It helps patients address other needs, such as their social determinants of health that may affect other aspects of their health. Netrin is a small organization with less than 10 employees, but it still provides care for more than 1,000 patients. This goes to show that there doesn't need to be a big organization to provide effective quality care. I see that value-based care model can be effective, as Netrin was able to generate net positive shared savings for Medicare in 2021. Overall, this practicum provided me with valuable professional experience and population health management strategies that I can take and apply in my future professional career. And that's it for my presentation. Thank you for watching this video on my practicum experience. Thank you.